Today, we are blessed to be sitting in front of Olixn Adams. He is going to share with us a lecture about the heart. So the title of today's talk is The Living Heart, a journey into the physiology, consciousness, and health of the heart. Dr. Adams is a board-certified practitioner of family medicine and practices holistic medicine at Southern Coos Hospital in Bandon, Oregon. He synthesizes the principles of Ayurvedic medicine and osteopathic medicine to provide a deeper understanding of physiology, spirituality, and the wholeness of life as it pertains to health, healing, and well-being. He's a faculty member of the Biodynamics of Osteopathy program and lectures internationally, teaching osteopathic medicine to physicians from around the world. He also is the director of the Pranada Wellness Center, a holistic healing center located at the Temple of Compassion in Burton, Texas. Our talk today is an offering of the Pranada Wellness Center. Pranada is currently offering educational talks like this one, as well as hosting an annual 5-day healing immersion at the Temple of Compassion. So our next retreat, our next healing immersion at the TOC will be April 11th through 17th of 2026. Olixn will be there along with an amazing team of osteopathic physicians, and it's an incredible program. I'll be putting a link to register in the chat today. And again, thank you so much, Olixn, for being here and sharing with us. I'm bowing to you and to our teacher, Pranada, and I'll hand it off to you.
Thank you. Good morning, Rosa. Good morning, everybody. You're welcome to place your, you can put your cameras on if you want. It's nice to see your faces, but you don't have to. Let's start with a prayer. Let's close our eyes for a moment, thinking of God and gurus, thinking about the heart, all the functions of the heart. Om Sahana Vavatu Sahano Bhunaktu Saha Viryam Karavavahai Tejasvi Namavitamastu Ma Vidvishavahai. Om Shanti Shanti Shanti. I humbly bow to God and gurus, to the breath of life. I bow to the saints and sages of all religions and all times. I bow to the teachers and masters of Ayurveda and osteopathy. I bow to my Guruji, and I bow to the divinity within each and every one of you. Om, Amen. Good morning and afternoon, everybody. It's very nice to see you all and spend some time with you. This is our first talk of our new Pranada season. The Pranada season runs about now, October through April, when we do the wellness retreat that Rosa spoke of. And we start with monthly talk, monthly lecture, educational lecture. Today is going to be about the heart. And next month, I believe Rosa is speaking on Ayurveda, and then Dr. Mitchell will be speaking on osteopathy, going deeper into the study of osteopathy in December. So we have a great team lined up, a great series of lectures and talks, and it's really nice to spend some time with you. Today, speaking about the heart, I want to think about the heart more in terms of a function than a structure. I don't want to think about it so much as the anatomy or the form, but actually the entire function of the heart. This allows the function to really express itself. It allows the heart to open, and it allows us to rise into higher levels of consciousness through the heart. If we think of the heart just as a form or an anatomical structure in the center of the chest, it really limits what it really is, what its true function is. We've spoken on previous talks about function and form, and we've said that the function is always much larger than the form. We gave the example when we were talking about the third ventricle in the brain and the cave of Brahman. And we said that the function of that is largely perception. So the function goes from the center of our being all the way to the high heavens and beyond. It's an immense, immense function, immense space, much, much bigger than the small space of the form. So that's probably one of the largest functions in the human organism, the heart possibly being the second largest. So when we begin to think about function over structure, function over form, we come to a much deeper understanding and appreciation for what's actually happening and what it brings to us. This is a gift, it's an incarnation of the divine in each of us. You know, in the Bhagavad Gita, in chapter 10, verse 20, Krishna says to Arjuna, I am the self, O Arjuna, seated in the heart of all beings. Seated in the heart of all beings. Our beloved Gurudev had a special meaning for the heart. He looked at the Sanskrit word for heart is hridaya, and hri can mean to take, and da can mean to give. Ya is that which. So that which gives and receives was Gurudev's interpretation of what the heart is, that which gives and receives. So, in a sense, we could say, you know, the heart is always giving and always receiving in many different functions in many different ways. It receives unoxygenated blood and it gives oxygenated blood back to the body. It receives different emotions and it can give different emotions back. So, in a sense, we have really three hearts. We have an anatomical heart on the left side of the chest. We have an emotional feeling heart that the yogis tell us is on the right side of the chest. And we have a spiritual heart located in the center of the brain in the cave of Brahman, which is inside of the third ventricle, right in the center of the head, behind the soul center. When we look at any form, any function, any anatomy from a holistic point of view, we start to see that each of these functions, forms, anatomy has their own personality, has their own expression of life, their own expression of the divine. So the personality of the heart, you know, in Chinese medicine, they call the heart the great emperor, the regulator of life. This, if we look at it, is very fitting in many ways because if the heart stops, life stops. Instantly, actually, more than any other organ in the body. You know, if your liver were to stop functioning, you could still live for some period of time. Your quality of life would be less, but you actually could still live. And same with the kidneys, many organs. But interestingly, we've noticed in the emergency room and other places, when the heart stops, life stops instantly. It's not like it stops and a few minutes later the life stops or the consciousness stops. It's like the consciousness leaves the body instantly the moment the heart stops. It's very, very interesting. It doesn't quite fit the physiology that we would expect because there should be enough oxygen and enough glucose in the cells to maintain life and consciousness for at least a minute or two. But that doesn't seem to be the case. It was interesting once when I was a medical student working in the hospital, I met a police officer who was a little older and he had had a heart attack and then the heart stopped. And as soon as it stopped, he went completely unconscious and he was given electrical shocks in the emergency room and it restarted the heart and it brought him back into the body and brought him back into life quite quickly. Well, he was actually upset about this. He told me later, uh, as soon as the heart stopped, he left and he was moving towards this incredible light and this incredible love. He said he felt more peace and more well-being than any time in his life. And when they gave him the shocks, it brought him right back into the body, and he was not too happy about it. He said he wished he would have just been allowed to pass on to the next stage. And he made me promise if his heart were to stop again, nobody would shock him. So it's interesting how the heart works. The heart is the center of our being, and we see that expressed in our culture, in our language. We hear often they have a heart of gold, uh, the heart of the matter, follow your heart, trust your heart. These are all expressions common in our culture. Heart of gold is an interesting expression because it turns out actually, in the human body, there's all of the elements and there's gold in the body. There's actually gold. And we found that there's more gold in the heart than any other organ or any other tissue in the human body is in the heart is gold. And in Ayurvedic medicine, gold is actually used to treat many, many heart conditions. There's ways to prepare tinctures of gold that are ingested and greatly support heart function, often used in dysrhythmias such as atrial fibrillation or other irregular heartbeats or heart problems. Another interesting thing that we've noticed about heart and the function of the heart that's been observed through allopathic medicine is after a patient goes through a heart transplant. There's actually been heart transplants where a patient will receive a heart from a donor. Somebody has passed of another cause, and they're able to donate their heart to another person and what we see with that is the person who receives the donor heart actually develops new memories. Sometimes they have memories that are related to the donor. And this has been scientifically documented to the point that many surgeons actually counsel their patients on this effect before surgery. There's been reports of after a heart transplant, the person develops preferences for food or activities that their donor expressed. There's been cases where the recipient actually fell in love with the donor's spouse or the donor's partner. There was a case where a pediatrician, her child passed, and the heart was donated to another child. And that child, then when they went to see the mother of the donor, recognized that mother instantly and went up and snuggled her nose right against the other one's nose, just like her child used to do, and began to display many habits, many tendencies that her son had demonstrated. It's very interesting. So we see that all of these levels are connected in the heart, the physical, the emotional, the spiritual. If you treat one, if you affect one of these levels, you're affecting all of the levels. There's a strong connection between the heart and the brain, the heart and the mind. And I use brain and mind differently. They're actually two different things. The mind is expressed through the brain. The brain is a structure in the body, but it's not actually the mind. The mind is much more than the brain. The brain and the heart are intimately related. They both generate a very strong electromagnetic field. That electromagnetic field is actually used clinically daily in medical practice whenever you get an EKG, which measures the electrical output of the heart and tells us a lot about the heart. That is actually measuring the electromagnetic field of the heart. The heart actually generates an electromagnetic field even stronger than the brain. Our teacher, Pragyananda, our Guruji, tells us that both the brain and the mind should be developed and open like a flower, like a lotus. The heart and the mind should open like a flower and a lotus. These two are deeply connected. Let's take a moment and look at the embryology of the heart, the growth and development of the heart. The beautiful thing about embryology is when we see how something develops, we learn something about its innate qualities. We learn something about its personality. Um, Embryology is really the study of love incarnating. So embryology is watching the breath of life go from formless to form. It's a really beautiful study. Um, the heart develops early in development, and it actually begins its development just under the brain. The heart and the brain are actually developing together and right next to each other in the embryo. There's a channel that's just under the fontanelle in the top of the brain. The fontanelle isn't really there at that stage, but that's where the fontanelle will emerge. And there's these two channels that come up from the sides that represent the Ida and Pingala channels, and they come across, and there's fluid in these channels. Not much blood cell yet, but primarily different types of fluid, different types of cells, mostly fluid. And this fluid is drawn up to the center location under the fontanelle, and it's drawn not by a pump yet, it's drawn by the electromagnetic forces of the brain. So the brain at this stage is developing very, very quickly, faster than anything else in the embryo. And it's got an electromagnetic field, and it's actually breathing. It's breathing very slowly. We call this in osteopathy primary respiration. Primary because it comes before thoracic respiration. It's the first breathing in the embryo. And it's electromagnetic breathing that's actually expanding and contracting. And it's drawing this fluid towards the center point, up the channels, the Ida and Pingala channels, and it's meeting in the center. And that fluid then, with all of the nutrients, creates and starts the growth and development of the heart. So the heart then starts growing in a transverse axis like this, right in the center. So it's actually growing in the Sushumna channel, right in the center channel. So it's receiving and integrating nutrients from the Ida channel, the Pingala channel, and then developing in the Sushumna right underneath the fontanelle. There's a transverse ridge where all this fluid begins to develop. So the heart actually grows in response to flow. That's a really important principle. The heart grows, is healthy, and develops in response to flow. That includes the flow of life, the flow of prana. So when we don't have flow in our life, when we don't have movement in our life, we don't have a healthy heart. And that traces all the way back to how the heart began to develop in the embryo. Rosa, we could pull up one of those pictures. Oh, we have it up. Okay, great. Back one. Yeah. So around number one and around number two, you see two channels coming right into the center there. And those channels then right in the center come back into the center there of the picture. Yeah, and up just a little bit. Right there is where the brain or the heart is developing, and right above it is actually the brain. So that's the developing brain, and that's a posterior view. So that's the backside of an embryo, sort of sliced through the middle, and we're seeing the brain and the developing heart right underneath the brain. Now, we don't actually see a pumping heart until the embryo does a very fascinating movement that is a very spiritual movement, and it's actually a bow. The embryo actually bows, and that creates the structure and the form of the heart. So if we go to the next picture, okay, so here's an embryo a little further along in development, and it's actually bowed. So it's bowed forward, and it will also elongate back upright. It'll bow and rise, bow and rise. Right there underneath the face, underneath the eye, is the heart. We see for the first time the developing heart right there. And you see the heart is nestled right up against the face and right against the forehead and the area of the third eye. And that emerged out of the area just underneath the brain. And so now we have a beating heart. The heart then responds completely to the growth of the brain, and its position changes as the brain grows and develops. If we go to the next picture, here we're seeing a series of the heart actually moving, descending as it grows, but it's in response to the growth and development of the brain. So the brain rises and the heart descends, and we have a two-way flow. Let's see the next picture. That's just a schematic from the side view, showing the heart developing under the brain before the bow. That's fine. We can go on. Okay, that's good for pictures right now. Very good. So we have this embryo and it bows, and the heart then, when it rises back up, stays behind. And the embryo actually goes through a series of bows. I think the most important thing that I take away from embryology is the heart responds to flow. It grows out of flow. It changes its position based on flow. That's movement. Ayurvedic medicine also recognizes the heart as being the center of our being, the center of our consciousness. And it's recognizing this integration function. The heart has to integrate many, many functions. So in the heart, we have prana, we have a large amount of ojas, and also vata, pitta, and kapha. And it's also the root of two major channels. So in Ayurveda, channels are a very, very important principle. Channels are empty spaces that allow substances to flow and move from one place to another. Now, these substances can be gross or dense, like blood. Nerves are also channels, which are allowing electromagnetic, electrical energy to move, and also prana. And we have more subtle channels, pranic channels, where the subtle pranic energy moves. So there's these channels all over the body, and they're very, very important. And each channel has its root or where it emerges from. And the heart is considered the channel of the pranavahasrota, which is the pranic channel, along with the manovahasrota, which is the mind channel. So the mind has its own channel that allows it to express itself through the entire organism. So the heart is the root of these two channels and very, very important in organizing all of these functions: prana, ojas, vata, pitta, kapha, the movement of prana and the movement of the mind, the flow of life and perceptions all moves through the heart. There's also a strong connection between the soul center, the Agnya chakra, and the Anahata chakra, or the heart center. So a strong connection between heart and vision. And there's a quote from uh, Vedic tradition: the heart must open before the vision becomes clear. The heart must open before the vision becomes clear. Ojas is also very important in the heart. It's said in Ayurveda that there's 8 drops of ojas in the heart. So the ancient seers and rishis were able to perceive the exact amount and quantity of ojas in the heart. And if this becomes imbalanced, we end up with heart problems. We end up with heart irregularity, irregular heartbeats, heart that grows too thick or too big, heartache, heart pain, all kinds of imbalances can arise. So let's talk a little bit about heart health, the health of the heart, what we can do to improve our health in our heart. One of the most important things that even Western medicine is beginning to recognize is loving relationships. Having loving relationships is actually one of the biggest modifiers in reducing your risk for heart attack. The first being smoking, stopping smoking if you smoke, reducing blood pressure. But after that, it's been scientifically studied and documented that loving relationships reduces your chance of having a heart attack or heart problems. It's very, very important. Now, really from a yogic point of view, for yogis and yoginis, every relationship is loving, right? Because our loving relationship is not dependent upon what's received, it's dependent upon what's given, right? And Gurudev told us that the heart is that which gives and receives. So we can always foster and cultivate a loving relationship. We're taught to perceive the divinity in all, see the health in all, see God in all, or see God not at all. This fosters a loving relationship in every relationship that we interact with, in every relationship in life. But then, especially in our most intimate and loving relationships, this is really, really important in heart health and actually reduces risk of heart attack, stroke, or cardiovascular disease. Unfortunately, it also goes the other way. And when we lose a loved one, we're statistically have an increased risk of having a heart attack or developing heart disease. And this is recognized in the medical field. Dr. Still first wrote about it in the 1800s. The founder of osteopathy talked about broken heart syndrome, and he recognized it after the Civil War. He was a doctor in the Civil War, and he recognized that the soldiers returning were having heart pain and heart trouble, and he called it broken heart. Later in the 1990s, there was a Japanese doctor who recognized broken heart syndrome, and it's called in the medical literature Takusobo cardiomyopathy. Takusobo cardiomyopathy was first written about in Japan in the 1990s, and this is called broken heart syndrome. So when you lose a loved one, you can develop this if you're not careful. And it presents a lot like a heart attack. There's actually pain in the heart. There's changes to the EKG. There's changes to the biochemistry and the biomarkers in the blood tests. And it's treated very similarly. But at the end of the day, it's a broken heart. So we need to address the emotional heart as well as the physical heart. What else can we do for heart health? Well, strong digestion. Digestion is the foundation of all aspects of health in Ayurveda. When we have strong digestion and good digestion, we're able to produce more ojas, which is the end stage of digestion. The last step of digestion is the production of this sacred substance, the ojas, which is our vitality, our immune system. And we already mentioned that ojas is very important in heart health. It needs to be perfectly regulated, the right amount of ojas in the heart. Um, Strong digestion also uh, supports better cholesterol. So it supports a lower cholesterol level and a more healthy type of cholesterol. We could make a short comment on cholesterol. We could do a whole class on cholesterol because it's actually a big topic. There's many types of cholesterol. And one of the questions that I'm most frequently asked when patients come to see me because I practice in integrative medicine is, do I need to be on a statin? My cardiologist said I should be on a statin medication to lower the cholesterol. And it's not always an easy answer, but there are some additional tests that we might want to consider and some additional things that we might want to do. And the first thing I always like to do is make sure that the digestive strength is optimized, that the liver function is optimized so it can process and break down the cholesterol. But then we can also look at some additional testing. Most commonly, when you go to the doctor, you're going to get a standard cholesterol test, and it's just going to show HDL, LDL, and maybe triglycerides. But there's a lot more nuance to it. And you have to often ask for these tests, ask your doctor to run these tests, run a more comprehensive panel. One of the tests is the LPA test, the lipoprotein A, which is showing a very specific type of the LDL cholesterol, which is the most sticky of the sticky. And it's a type of cholesterol with a additional protein added onto it called apolipoprotein A. So it's called a lipoprotein test. If you're high in this, it can really further atherosclerosis or plaque buildup. And it also interferes with breaking down of clots, and it really increases your risk for heart attack and stroke. It's inherited. Um, so it's often good to test if you have a family history of heart disease or stroke, especially early history. If you have a personal history of heart attack or stroke, if you have unexplained high cholesterol, aortic valve disease, or family history of elevated cholesterol, you might want to ask your doctor to test for this. Um, it's not that easy to treat. The best way to treat if you do have an elevated LPA is really an anti-inflammatory diet, reducing stress. Niacin can help a little bit. So that's one of the more important tests. There's other tests that can be run to kind of help sort this out. There's a LDL particle size, homocysteine, IL-6, a CRP, fibrinogen, ferritin. The interesting thing, all of these tests, most all of them are really measuring inflammation. So what we're seeing is inflammation is actually a bigger driver than just cholesterol because the inflammation is what allows the cholesterol to form the plaque, to form the blockage in the arteries. So anti-inflammatory shows up all over the place in heart health. A lot of it, a lot of the things we're going to talk about and test for and do are largely about reducing inflammation. So we said diet is really important. Actually, what we said was digestion is good. We need strong digestion, but also the right food and the right input. Um, Western medicine, they're going to recommend a Mediterranean style diet, an anti-inflammatory diet rich in vegetables, fruits, whole grains, legumes, olive oil. minimizing processed foods and sugars. If you work with an Ayurvedic doctor or Ayurvedic practitioner, it's going to get much more nuanced than that. And it's going to look at balancing your doshas, your vata, your pitta, and your kapha, along with reducing inflammation and strengthening your agni, strengthening your digestion, adding in digestive spices, turmeric, cumin, and ginger. Um, but the diet is all going to be organized around your dosha. So to simplify, we can just say Mediterranean style diet, rich in fresh vegetables, fresh fruits, avoiding processed foods, and reducing your sugars. Reducing your salt intake, big deal as well. That greatly helps reduce your inflammation. Most American diets are way too much salt, and you could cook without salt and still get plenty of salt in your diet. Just if you go out to dinner once a week, you've got your salt intake for the week. So what else can we do for our heart health? Exercise, very important. Every system of medicine, be it Ayurvedic, Western, traditional Chinese medicine, all recognizes movement and exercise are essential to heart health. Western medicine is going to tell us about 150 minutes per week of aerobic activity, plus some strength training. Ayurvedic medicine is going to get, again, more nuanced because it's going to look at your dosha, it's going to look at your life cycle, it's going to look at the season, and then we're going to adjust our activity and our diet and our exercise based on all of these factors. But I think really the most important thing when it comes to exercise is do what you love to do. Do any activity that you enjoy is really the key because life is already full of enough things, enough have-tos, um, that to add an exercise routine that you don't enjoy is not going to support heart health. So pick an activity that you enjoy, pick an activity that you like, and do it. Then if you work with an Ayurvedic doctor or practitioner, the activities can be refined to better support where you are in your life cycle, where your what dosha most needs to be supported and what the season is. Another big one is living in harmony with with the rhythms of life and getting enough rest. So lack of sleep is actually a risk factor for heart disease. And living out of synchronization with the movement of prana, with the movement of breath of life, is a risk factor for heart disease. We've spoken on previous talks about the pause and the importance of the pause. And there's these pauses throughout the day, throughout life. And when we notice the pause and actually stop and synchronize with it for a few moments, we're doing a lot for our heart health. We're doing a lot for our overall health, but especially the heart, because the heart has a pulse. It has a rhythm. It's the pacer of the physiology. And so it's deeply in sync with the rhythm and the movements and the motions in the natural world. So when these pauses come, if we're in sync with them, we're doing a lot for our heart health. And you can look back at some of the previous lectures. We've gone into much more detail about pauses, what they are, how to listen for them, and how important they are. And Ayurvedic medicine recognizes this very deeply and has a whole branch in their science called dinacharya, which is our daily routines, which put us in sync with life. And we go into a lot of detail about this at the Pranada Wellness retreats and on other talks. Dinacharya has been reviewed in a good deal of detail. Another big one for heart health is stress reduction and emotional balance. So this is interesting because if somebody is under stress and feeling stressed out, we can't just tell them to relax. That's not going to do any good, right? If you tell someone to relax when they're stressed, it just creates more stress, right? So, what are the practical steps that we can take to reduce stress or to manage stress? Because stress really is part of life, and it actually is an essential part of life. And our relationship with stress is one of the biggest factors to how we manage it, to how we relate to it. If we perceive stress as a big bad problem, then it is a big bad problem. But if we perceive stress as also an essential part of life that's necessary for growth and development, necessary for a balanced physiology, then we can approach these stressful situations with more mindfulness, with more joy, with more acceptance that that is what the breath of life is bringing in this moment. So that alone can help to reduce stress and manage stress. We can also look at it through an Ayurvedic perspective, through the gunas. Rosa, if you want to pull up that picture that has the chart of the gunas. So the gunas are the qualities of life, and they're actually paired in opposites. So for every guna, there's an opposite. So they keep everything in balance. We could further look at these gunas as catabolic and anabolic. That is, gunas or qualities that deplete or make things less, and gunas or qualities that build or make things bigger. So stress tends to fall under the category of catabolic. If you're under high stress for a long period of time, you tend to lose weight, you tend to get drier skin, you tend to get more of the qualities or the gunas that are on the left side of that chart. So the natural remedy would be to introduce its opposite. That's a basic Ayurvedic principle. Introduce the opposite. So we can then introduce things that balance the catabolic process of stress. So we want our food then to be warm, smooth, well cooked. We want routines. We want to establish a routine in life because routines are stable. And the stable guna counterbalances the mobile guna of stress. We want to take extra time for rest because rest enhances the gunas of soft, slow, dense, and stable. We want to favor sattvic foods that are smooth, soft, warm, and well cooked. We want to eat slowly and appreciate the food. Eating is actually a sacred, divine event. It's the self feeding the self. It's self-nurturing, and it's an important part of life. So if we slow down and eat the proper food and appreciate a little bit of self-care, we begin to naturally establish the gunas, the qualities that counteract the gunas or the qualities that are being accentuated or expressed in stressful environments. So I find that a really nice way to help us balance stress rather than just say, just relax. Just relax. You say that to somebody, it causes more stress. We also have all of our breathing, our pranayamas, mindful breathing, slow, long, deep breathing, all the breathings of Kriya. These all support um, balancing the stress and heart health. Okay, thank you, Rosa. That's good for that picture. So A little review. The heart is an integrative, multifunctional organ that organizes many, many relationships in life, and it's the organ that gives and receives. We have three hearts: a physical heart in the left side of the chest, an emotional heart that feels life, and a spiritual heart. We support heart health by reducing inflammation, by meditating, by cultivating loving relationships, by finding activities that you enjoy, by gratitude, gratitude for life, gratitude for everything that's being given to us in life. Gratitude is the great flow. Gratitude is great flow. And we said earlier that the heart responds to flow. The heart grows because of flow. That includes blood flow, oxygen flow, pranic flow, the flow of life. We try to eliminate or reduce sugar, salt, soda, processed foods, um, trans fats. By trans fats, I mean hydrogenated, which are things like French fries, packaged cookies, crackers, margarine, many non-dairy creamers. Oh, microwave popcorn is a classic one that has a lot of hydrogenated oils. And we try to favor certain foods such as berries, cherries, almonds, beans, turmeric, olive oil, ghee, vegetables. If you're going to eat animal protein, favor wild salmon or grass-fed meats. So we'll take a moment and see if we have any questions from anything we've spoken about.
Thank you. I want to encourage anyone who might have a question for Olixn to put it in the chat and we'll read it out. I think you might also have the function of raising your hand and then we can call on you too. That would be fine. So anyone with questions for Olixn, just feel free to share them and we'll try to get to everybody. And maybe while we're waiting on that, I have a question if I
Yeah.
can share it. So this has just been so fascinating on so many levels. And one of the things I find myself wondering about is the family history, family history of heart issues. Can you talk a little bit? Because you mentioned memories are held in the heart, and I'm wondering what your perspective is on that.
Yes. So we're influenced in this body by many factors, and one of them is the genetic field is something that has an influence, and that's shows up in our doshas. It shows up in our physiology and our constitution, and it shows up in our whole physiology. And the heart is in tune with two types of memory because the heart, remember, is responding to flow. And memory is essentially a flow of thoughts flowing. And there's two memories. There is a temporal memory, which is in time and space. And there's a deeper memory called eternal memory that is the memory of who we really are, our true nature. So we can attune our heart to the deeper memory of who we really are. Because whenever we've experienced any trauma, pain, difficulties in life, that memory doesn't go away. It's there. But what happens is we begin to attune to the deeper memory, the the deeper current And when we attune to that memory, it awakens the heart to a deeper reality. It awakens the heart to the deeper nature of who we are. Sometimes the yogis describe memory as this deep, vast reservoir because the entire memory is there. The entire memory of this life, past lives, the whole genetic field, the whole of humanity is stored in this chitta, this consciousness of life. Out of that is flowing the memory, and there's two currents, they say. One is a superficial current that is in time and space, and the other is the deep underlying current, which is an eternal memory. So we want to then try to attune our heart to this deeper memory. And that will change the physiology. It will change our relationship to trauma, and it will change our relationship to life in the world in general. Kriya meditation is an excellent medicine for the heart. In Kriya, the life current rises from the heart to the spiritual eye. And then through grace, the grace descends back from the Ajna chakra, back from the spiritual eye into the heart, awakening divine love. So we can also, through our meditation, awaken this eternal memory. It's very beautiful. And that meditation can start anywhere. It can start in the heart. It can start in the third eye. It can start in the crown center. And if we feel our heart in our heart center and think of anything that you love, it can be anything. When we think of that love, there's a little tingling sensation, a little sensation around the heart. That's the emotional heart picking up that vibration. And then that tingling sensation begins to rise up. It slowly rises up, and we allow it just to rise into the third eye, Anjana chakra, and just sit there and feel the peace and the love. And at a certain point, it turns around and the grace descends back down into the heart. Very beautiful. I don't know if we answered your question, but that's what we get.
You absolutely did. Thank you. So we have a few questions rolling in. I'll start with the first one. So the question is, what is an enlarged heart? One that happens within a year or two in an adult over middle age.
Okay.
Is it a risk of death or heart attack? What are some Ayurvedic osteopathic medical?
Yeah. So enlarged heart is called cardiomyopathy. Cardio is heart, myopathy is large. And the heart can enlarge for many reasons. So the treatment is largely based on understanding the reason. So the heart can enlarge from high blood pressure. If you have high blood pressure for too long of a time, the heart has to enlarge because it's having more resistance to its pumping activity, and it will actually get thicker and larger. The heart can enlarge from too much alcohol. So there's alcohol-induced cardiomyopathy. Too much alcohol is like a poison to the heart. The heart tissue is very sensitive to alcohol, and too much alcohol will cause the heart to enlarge. The heart can enlarge um, from sleep apnea. If you stop breathing in your sleep for periods of time, it can lead to heart enlargement. The heart can enlarge from too much stress. We mentioned broken heart syndrome earlier, that the Japanese doctor discovered in 1990. The Takashimo syndrome can actually result in enlarged heart. One of the side effects of that is enlarged heart. So the treatment then becomes understanding what the cause is. If it's high blood pressure, we want to get the blood pressure under better control. If it's a broken heart, we want to allow the heart to heal by attuning to this deeper memory of who we really are. And finding the things in life that we love and reestablishing loving relationships. Um, Under the care of an Ayurvedic doctor or practitioner, you might be prescribed gold or herbs such as Arjuna or Roksha. Roksha beads are very beneficial for the heart. Wearing Roksha beads or even soaking a Roksha bead in some water overnight and drinking that water. The Roksha bead can be used again and again to create that tincture of water, and drinking that water will help the heart. And then all of the things that we spoke about earlier will help reduce the risk of enlarged heart cardiomyopathy. Thank you.
Thank you. I had not heard about Rudaraksha beads being used in that way. That's really interesting.
Yeah.
And our next question, I'm going to summarize them a little bit so that we're not giving away too much personal information. So this person is asking about the liver, specifically a condition called Gilbert's syndrome, and the relationship to the heart. They say that they are having palpitations and are concerned about the relationship, but maybe that liver-heart connection. If you could speak to that.
Yes. So the heart, again, is the center of our being. It's the center of our physiology, and it's in relationship to every other organ in the body. There's a deep relationship between the heart and the kidneys. Our next talk will speak more about the kidneys. And there's a deep relationship between the heart and the liver. If you get congestion in the liver, it can cause a good deal of strain and difficulty for the heart to get the blood to pump through the liver. The liver is deeply involved in digestion and in the formation of ojas. So the ojas can get out of balance, and out of balance ojas is going to lead to a lot of heart difficulties. So if you're experiencing liver difficulties, bitter foods tend to be very beneficial for the liver. The bitter flavor, such as turmeric or bitter melon, are all very beneficial. Bitter herbs are beneficial for the liver. There's a special ghee that can be taken a little bit each day that's beneficial for both heart and liver. And it's a bitter ghee that has bitter herbs infused into the ghee. And you take a small amount, a teaspoon each day to support the liver. And if you're having a lot of liver trouble, I would suggest to get a good consultation with an Ayurvedic practitioner, doctor, or holistic doctor that can look at the whole picture and support this so that your recommendations and advice are tailored to your specific conditions and physiology. The emotion of love is also very important because the heart is regulating the love. And also, if there's not enough love and we tend towards more anger or irritability or agitation, that aggravates both heart and liver.
Thank you. Our next question is also kind of a personal health question, which I'll summarize. This person is saying that they have extremely high LPA and LDL. They're vegetarian, not on statins, free of on. Interested if there are any other recommendations and if being a vegan is an appropriate diet.
So you may want to go into a little deeper profile with the labs, including a homocysteine, an IL-6, a CRP, a fibrinogen, a ferritin, and an LDL particle size. Working with the holistic practitioner, they can look at all of those together and come up a little bit more with your risk of that elevated LPA. And then they may consider a coronary calcium score or a coronary calcium test, which is a specialized test that can show how much calcium and plaque is already building up in the arteries. And all of that information can be put together into sort of a risk stratification for you. And then looking at mitigating risk through the things that can be controlled. Things to consider would be liposomal vitamin C, which can help to reduce plaque and inflammation. And liposomal C is a C that's infused into a fat-soluble molecule. It's much more bioavailable. It's much more easy to digest. It's much easier on the stomach. It's much more potent than standard vitamin C. And you don't need a high dose of it because of its potency. So 500, 1,000 milligrams might be sufficient. And that would be the equivalent of like 10,000 milligrams of a regular vitamin C. Then adding in some CoQ10, the exact dosage would be tailored to you, but probably somewhere between 60, 90, or 100 milligrams, not more than 200 milligrams taken with food. But again, that's sort of tailored and personal to you that you should discuss with your provider or practitioner. Niacin is used to help reduce LPA. It's not real strong. It doesn't reduce it by a large amount, but it will help reduce it a little bit. There are some other new medications coming out that are specifically targeted for LPA. They're new. I don't know a lot about them, but they can be explored with your provider or practitioner. Otherwise, the things that we discussed will support that. Strong digestion, strong Agni, healthy liver, anti-inflammatory diet, all of these things will help reduce the risk of LPA causing cardiovascular disease and problems. Thank you.
Thank you. Our next question is referring back to the embryological development of the heart. This person is appreciating your perspective and is asking, so in this sense, the pulse, the movement in the fluids precedes the dense physical form of the heart. Is that correct?
Well, what we're talking about embryologically now is actually two different pulses. So the first pulse is an electromagnetic movement of the prana through the brain. And the movement of the brain that we call primary respiration is driving that movement of those fluids. So that's the first pulse or the first breathing. Then later, after the embryo bows and the heart establishes its position in the center of the chest, that's when it actually begins its contraction and its beating. But the other breathing doesn't go away. So we have different breathings and different pulses that are connected. That beating of the heart uh, doesn't actually start until after the embryo bows and the heart establishes its position. Then it starts to contract and starts to help the pump of the blood. So the blood circulation is not just dependent upon the heart, and the heart is much, much more than a pump. And the movement of the blood is not dependent just on the pumping of the heart. It's also the breathing, the movement of the prana, the thoracic respiration, the primary respiration. All of these factors come together to create this circulation. And the electromagnetic field coming off of the heart is having an effect on the movement and circulation, not just the pumping. I hope that answers the question.
Beautiful. Our next question is asking, for those who work with individuals with deep emotional heart wounds or trauma, what can we do to support them, specifically children?
So again, trauma, the memory of the trauma doesn't go away. And that's not the objective of working with trauma. We want to support the individual to get in touch with the deeper memory of who they really are, the part of themselves that never becomes injured because at the core of our being, the true self, the health, it never becomes injured. It's immune to trauma. It's immune to injury. So we want to support a movement by recognizing that as an essential truth, not by telling them to remember this, but starting to recognize it in them and appreciate that there's something perfect that is always there. In osteopathy, we call it the health. There's something perfect there. And starting to get that sensation first in ourselves so that that sensation can express through a balanced rhythmic interchange to the heart of the other person. It's interesting, even modern medicine, modern science is recognizing an electromagnetic flow between hearts, between hearts. So whenever we have an exchange, a discourse, a conversation, there's an electromagnetic exchange. In osteopathy, we call it balanced rhythmic interchange. And there's a scientific term for it that I can't recall the name right now. I wish I could because it's a really interesting term, but they're recognizing that there's a flow of electromagnetic energy between people. So if you're working with a patient or a client that's suffering from heartache and you're in tune with your own true heart, your own true self, you're going to be transmitting that truth. You're going to be transmitting through your heart. And that heart can be coming from the spiritual heart or the emotional heart. It's going to transmit the essence and the truth of the deeper memory, the memory of the soul, the memory of who you really are. That comes through the heart. That transmission can come through the third eye. That transmission can come directly from the heart because remember we said there's three hearts and they're really all one. So if you enter into this center or this center or this center, you're ultimately still in the heart. You're still in the heart. So through our meditation, through our Kriya practice, through our remembrance of who we really are and feeling that and allowing that to transmutate and transform our own heart, it will support everyone we come in contact with to have that same transmutation. So everybody's a healer. Everybody's in service. What are we transmitting through our heart into the world, into our relationships? Whether you're in a therapeutic relationship with the client and a patient, or your neighbor, or your loved one, or your spouse, or your student, or your teacher. There's a balanced rhythmic interchange happening throughout life all the time, which has been recognized by saints and sages for eternity and is now being recognized uh, by Western medicine and modern science. Any healing starts with ourself. We have to be in touch with our true self, our true nature, and allow that to move through the heart. The rest will emerge naturally.
So beautiful. Do you have time for a few more questions?
Yes, we have a few more minutes.
Okay. So you might have, I feel like you've answered this question in a few ways, but it's worth asking. This person is saying that there's a family history of heart attacks. They're on their paternal side, their father, their father's father. What is their risk of having a sudden heart attack as their paternal father and grandfather did, and how can they mitigate it?
Yeah, so we've spoken a lot about ways to mitigate risk. Risk comes down to statistics and numbers. There's a lot of ways to work with that. Uh, you can get the testing done that we spoke about, those tests, LPA, LDL, homocysteine, IL-6, CRP, fibrinogen, etc. And then with the practitioner, also look at your cholesterol profile, your blood pressure, and the medications you're on. And that can be put into a formula called the Farming Hands formula. And it can give you a risk stratification. It can give you a risk profile in an absolute number, like 9% chance in the next 10 years, or 8% chance, or 5% chance. If you want that kind of information, it can be done. Then it can also be looked at in a different view, and you can put those numbers into the formula and say, if you reduce your cholesterol to this number based on these medications, your risk is reduced to this amount. So if you're interested in that information, you get with your provider, get those tests done, look at the blood pressure, and run a risk stratification through the formula. It's going to give you a number to work with. Some people like that information, some people don't. So it's a matter of preference. Um, but finding loving relationships, reducing or mitigating your stress in life, following a healthy lifestyle, practicing the Kriya Yoga. Kriya Yoga is such an excellent meditation and such an excellent medicine that it balances so many health conditions. Those are the things that you can do and take control of right now, today.
Thank you. Our next question, this person is thanking you for these teachings and has a father with stents in their heart. Anything specific that they can do to improve heart health given the stents? You might have already mentioned things, but they're asking.
Yeah, just because they're stents, it doesn't change anything of what we've said of the things that we already talked about to improve the health. From Western medicine allopathic standpoint, he's going to be meeting with the cardiologist and they're going to determine how long they need to be on a blood thinner, um, what kind of medications can best support him. But the stents don't change the fact that reducing inflammation, having a healthy diet, having loving relationships, living life to your fullest are all things that support heart health. You know, the heart responds to flow. Flow is the breath of life. So getting in tune with the breath of life and your creativity, living a creative, dynamic life is extremely beneficial for your heart, all of your health, but especially your heart. Heart responds to flow. Heart is the organ that gives and receives. So get in tune with the breath of life, the movement of life, get inspired. Where's your creativity? What inspires you? What activities? What do you want to do? How do you want to live your fullest, most dynamic life full of service and love today, now? That's going to bring you the best heart health that you can imagine, regardless of any statistics, regardless of any medications. Your Kriya meditation is the best medicine. It creates a dynamic life that's in service to all. This is heart health. It's a dynamic, balanced rhythmic interchange with all of life. And it's not dependent on what you're receiving, it's dependent upon what you're giving. What you're giving out is more important than what you're receiving. That's the transmutation. That's transforming our heart in spiritual practice. And all the three hearts are connected, so you affect the health of one, you affect the health of all. The spiritual heart, the emotional heart, the physical heart. And you touch any one of them, you've touched all three. Feel this love in your heart. You know, in the Upanishads, they teach the meditation is to first bow to the Guru, first bow to that which you love, and then feel the peace and the calmness inherent in the heart. Sit in that perfect calmness and meditate on divine, which can be Satchitananda, existence, consciousness, and bliss. So feel that love in the heart. It can be any of the three hearts. You can pick any of those. Those are all the three seats of the heart. And feel that peace and that love that's there. bow to the Guru and meditate deeply. That's how they've taught us to take care of our heart and to meditate nicely and deeply.
We have around two more questions. Do you have
Okay.
them? First one is, if the muscles are weak or atrophied, how does that affect the heart?
Well, the heart is a muscle. So if there's trouble in other muscles, there's a good chance that there is some trouble or compensation in the heart muscle as well. Arjuna and ashwagandha are excellent herbs for strengthening the muscles in the heart muscle and all the muscles in general. So you just want to slowly begin rebuilding the strength, light walking, building the strength in the extremities and the muscles, and also the muscle of the heart. They work together.
And then our last question, um, there were some questions about the ghee, and I put a link there to a type of ghee that Olixn mentioned from Banyan Botanicals. It's also called Tiktik Garita, which means bitter ghee. And then the beads are called Rudraksha beads. I put that in the chat. Our last question is another specific health question. So I'll try to summarize. This person has cholesterol 216, HDL 71, um, HDLC 3, and the cardiologist was recommending 900 milligrams of a medication based on pine bark called Cholestov. I don't know if I'm pronouncing that right. Is it okay to take that? This person eats a very healthy, low salt vegetarian diet.
Mhm. So, personalized recommendations are going to be best and safest discussed with with your provider, because there's a lot of nuances there. And you may want to look at the whole cholesterol profile, including the LDL particle size, the homocysteine, and the LPA, and discuss it with the provider in a more intimate way that recognizes the nuances of your physiology, your doshas, the state of your health goals, will be the best way to approach that. So you want to approach it holistically, looking at the broader lab profile than what was mentioned there, the broader testing that's available, and then a more nuanced view of the physiology would be the way to approach that rather than to say yes or no uh, over a Zoom chat to a particular medication. Each person's physiology is very dynamic and very individual, and we need to approach the care and the treatment through an individual approach. There are some broad recommendations which we've given that help a lot, but when we get into the nuances of herbs and medications, we want to tailor it a little bit more. Speaking of the bitter ghee, it is a great time of year to be taking a little bit of that as we leave the hot pitta season of summer, and taking a little bitter ghee can help clear the pitta dosha and bring into balance. Um, the bitter ghee, if you take too much, it can aggravate the vata dosha. And so if you start to feel a little bit dry or irritable or irregular, then you may want to stop it or add in some herbs and food that help balance the vata dosha. And you can talk that over in more detail with your provider, your healthcare provider, practitioner.
Thank you, Olixn. There's lots of gratitude coming in. People just really, really enjoying the talk.
I'm grateful to everyone. Thank you.
I'm so grateful. On that last note, there is a little question about how to take the ghee with or without food, what time of the day, if you could.
Do you want to address that, Rosa?
I can, yeah. So with the bitter ghee, there's there's many ways you can take it, but just as a therapeutic, just to get that therapeutic benefit every day, Dr. Ladd would probably recommend that you take just a little bit, maybe a teaspoon, or a few teaspoons of that ghee melted on an empty stomach first thing in the morning. And
That's
yeah,
how I take it.
it's okay to take it if you have high cholesterol. Somebody's asking that in general. And
A small amount should be okay. You want to be cautious if the cholesterol is extremely high, but a small amount of ghee, like you just mentioned, should not have a dramatic effect on elevating cholesterol.
just more and more gratitude is pouring in. Yeah, people are just very thankful. If you have any closing, yeah, thoughts, really welcome.
Okay, well, we'll close with a little prayer, remembering, feeling our heart center with deepest love and gratitude, thinking of anything, anyone we love, and feeling that movement of prana around the heart and allowing it to rise up into the soul center, feeling the peace and calmness in the soul center, and allowing that to move through the whole of life with deepest love and gratitude. Om Purnamadaha Purnamidam Purnamudachyate Purnasya Purnamadaya Purnamavavashishyate. Om Shanti Shanti Shanti. I humbly bow to the divinity within each and every one of you. Thank you for your time and your questions and all that you do in service and love in the world. Om. Amen. Thank you, everyone.